Hello everyone, welcome to the first episode of Health Series on Unique Achiever channel. Today we'll be discussing PCOS and PCOD. So we are delighted to have Dr.Geeta Patki with us to share her expertise on this condition. Namaskar ma'am.
Namaskar. Myself Dr. Geeta Patki, Head of the Department and Professor Stri Rog Prasudi Tantra in Gomantak Ayurved Mahavidyalaya, Shiroda, Goa. I am Ayurvedic gynecologist. With that reference, I want to highlight about the normal menstrual cycle and abnormality of the different menstrual problem. Precisely, today's our topic is a polycystic ovarian disease.
So before discussing on PCOS, let us know what is normal menstrual cycle and when it's abnormal.
In a female life from completed 12 years to 50 years of age, the lady get per vaginal bleeding. Generally, it remains to 3 to 5 days. In our classic, it is referred, it shall be without pain. There shall not be any pain. Very regular, like once in a month, without any clots, without any burning, or without any mucoid thing. And it shall happen naturally. What it indicate normal menstrual cycle? When the lady or that girl is having the regular menstrual cycle, that means it indicate her reproductive system. You might know this is a photograph of female reproductive system. It is normal. What is the normal function of the female reproductive system? To get regular menstruation, regular ovulation. That means her month, every month, there is a one egg is liberated, which is in future helpful for the formation of the baby. In other words, for the fertilization, for the fertility or give birth to the child, the essentially menstrual cycle must be normal. That is the indicator. We are dealing with the patient, we are asking every time when you got your last period, whether the cycle is regular or not. Why? It is a retrograde approach to the diagnosis. If the cycle is normal, that means roughly, not internally, roughly we can tell her system is normal. This is a very essential thing. So, I would like to tell one model. See, this is a cycle. Cycle means episode or the event takes place very regularly, one after another. See, first 2, 3 to 5 days, there is a per vaginal bleeding or per vaginal passage of the inner layer. The correct scientific, the inner layer of the uterus is there. See, you can see here marked. Roughly it is shown 1 to 7 days. Generally, it is a 3 to 5 days. That layer itself is vanishing out or cleaning of uterus takes place.
So ma'am, it can last from 3 to 5 or even 7 days.
Very rarely 7 days, but not heavy. So the generally 3 to 5 days actually flow is there. Then sometime remnant part or in the terms of the spotting or very scanty amount. But if the 7 days she is bleeding, that is not normal because she will get other complication, less hemoglobin or anemia. Then when see this layer is vanishing off, the new layer forms. Regeneration. You know the kheti, that field, no? Every time cropping is cutting, some roots are there, again it grows. Same thing is there. What roots are there? It is growing very slowly. Here somehow mid-cycle there is ovulation, egg formation, and again there is a seed duplication, double the layer takes place. Why it is like this? Here, when if the girl is married, that lady is married, and they have the intercourse, there is a chance of the pregnancy. For that, the supportive soil is there. This is the inner layer. If there is no pregnancy, that means it has to vanish off, it has to cut off, it has to come out. It is referred as a menstrual or menstruation. It happens cyclically, that's why it is menstrual cycle. During pregnancy, during post-delivery period, there is no menstruation. When again the repair takes place after delivery, after few months, say 6 months, 4 months, 3 months, as per her recovery time, again she starts till her menopause, that is the stopping of the menstruation. So this is a very important physiological event. It is absolutely normal, but still diet, her lifestyle, her constitution. You might have no, now Pradhan Mantri have started Prakriti Parikshan. Individual constitution, it differs here and there, but normal case is cycle. What I mean to say, one girl is having the menstrual cycle of 1 month, that means 30 days. It shall come 30 days, not like 1.5 months, not like 3 months, not like after 15 days also. That is normal for that.
So ma'am, one out of every 10 women is suffering from PCOS or PCOD. So, can you explain us PCOD and PCOS in simple way?
Yeah. Uh, PCOS or PCOD, the long form of it, polycystic ovarian disease or polycystic ovarian syndrome. Disease is limited to the ovary, just for as general population I'm telling, and syndrome, that means all symptom and the sign or all pathology it invade the or it fully cover the body. That is the syndrome. And there are lot of symptoms takes place. The basic thing, it is expected one ovary will give one ovum, that is one cycle. Here what happened? The polycystic ovarian disease, that means ovaries start dysfunctioning. Ovaries are not working, ovaries are sedating or ovaries are sleeping. We have hand, but it is not working. In level we have hand, it is not working. Same thing, the lady, girl having the ovaries non-functioning. That means they are not able to produce the eggs. They are not able to produce the hormones, which are essentially for her feminine functions, which are essentially for her fertilization or pregnancy. So the ovaries stop functioning and it turns into the multiple cyst. Cyst means fluid filled sac, like bubble, balloon. That ovum it is supposed to produce eggs. It's stunted, it remain there only, and it turned to the ovary in a big volume, swelling of ovary. We are explaining to the patient there is a swelling of ovary. How it takes place? There is a retention of the non-growing follicle. That is a polycystic. But see, this is only pathology to the ovaries, but it is affecting the whole body. Whole body. It is a defeminizing disease. Scientifically, you are telling. That means female hormones are disturbed and girl is going towards the male hormones. Now you understand how much it is severe. Because female body is designed for specific function and it doesn't happen and it turns to the male hormones or n number of the changes.
Ma'am, can we know what are the hormones related to this?
Yeah. See, more specifically, ovarian hormones are estrogen, progesterone, inhibin. But that is a less role here because only estrogen will be there. Now, estrogen dominating phase because there is no ovulation, no progesterone. But it is going to reflect on all other hormones like androgenicity. Male hormones are increasing. That's why the testosterone. You had seen no some polycystic patient. There is a hirsutism, means abnormal hair development onto the cheeks. Mustache and beard comes. Then the pimples will be there. Sometimes voice is changed, little bit rough, then followed by totally masculine voice. Hair fall is there, or baldness like the male. So, no, so many things. So, coming to the point, testosterones are disturbed. Again, it is not only reflecting that. See, in our body, now it fantastically. Brain is having two organs, hypothalamus, pituitary. These are the controlling so many hormones. The master of orchestra. It is giving the negative impact and all hormones, FSH, means follicle stimulating hormone, LH, prolactin, everything disturbed. Common prominently we are stressing is the thyroid dysfunctions. So the polycystic, coming to the general awareness period, ovarian dysfunctions are there and gradually it is going to affect on so many things like the thyroid dysfunctions, even high sugar. I'm not labeling only the diabetes, high sugar, then increased estrogen, endometrial changes, so many hormonal changes takes place.
Ma'am, what are the common symptoms we can see in PCOS or PCOD?
Yes. First commonest symptom is irregular menses. I am repeating. Irregular menses, bad luck, that girls and mother, that is the parents, they are neglecting. They are thinking my child is small. Of course, we understand up to maturation, say teenagers, say roughly 16, 18 years, there is a here and there irregular menses. There is a here and there. But after maturation also there is a no menses, that is the absence of menses, irregular menses, that is the first symptoms. How irregular? Sometimes they are not menstruating regularly, they require some medicine to get it. Then second thing, obesity or central obesity. See, 1 or 2 kg weight increases in a year, that is acceptable. But sudden weight gain, we are asking patient in a span of 3 months, in a span of 6 months, how much weight increase? Of them also central obesity, neck, breast, abdomen, there is a tummy. That is a collection of the fat. Third thing, hair loss. So much scalp hair are going, or lateral hairs are falling off without any reason. There's no dandruff, no other things, but hair loss is there. Then the followed by hirsutisms, that means abnormal hair development onto the body, male type of the hair development on upper lip or where that is Ladymishakas. Then pimples, colonies of pimples. Naturally in teenage little bit pimples acceptable, but there is a colonies in bunches it is coming and having the pinhead red color pimples. That is basic sign and symptoms. If the lady is married or they are trying for pregnancy, no fertility, that means no pregnancy, that means infertility because there is no egg formation. These are the general set of the symptoms. But what happened when patient is to doctor? When she become this figure, her beauty is hampered. Her face is rough, having the hairs and other thing, obesity. Then they are coming to the doctor. That's why please take care. In that platform, I would like to tell the parents and the ladies, definitely small, that is a teenage girl, it's duty of the mother or the parents. 100% they are supposed to seek for their regular menstruations. If it is missing more than 3 cycles, please meet any health consultant, specifically gynecologist. That is for sure. Not like this, she's small and we'll see after 25 years, no.
After marriage.
Or after marriage, yes. Even after marriage also they are telling after 2 years, we don't want child now. When we want child, that time we do. Don't do, please. This is a physiology. It doesn't change in overnight or in 8 days. Please. Other thing, uncontrolled bleeding. Sometimes they are not menstruating, and when bleeding start, it doesn't stop. That also another symptoms. Or high diabetes or diabetes related infections. Then also it may diagnosed.
How can teenagers recognize the signs of PCOS?
See, avoid googling or online search.
It is a
Yeah,
half knowledge.
half knowledge. And what happened? No, you told 1 in a 10. No, I'm telling 1 in a 3 girls. If I'm searching a 1 in a 3 girls, there is a polycystics. There are grades, grade 1, grade 2, grade 3, like this, and everyone want to hide. Okay, that's why please take a note of it. And if the periods are missing or sometimes very scanty, namesake periods are coming, but only spotting is there, which remain for 8 to 10 days. And what girl patients understand? No, I'm not getting for 3 days. No, that's why small amount I'm getting for so many days. It is alarming sign. Then abnormal hair development. These are the quite common. The first is the menstruation. Then irritability, headache, less of concentration, so many things. When they affect the on higher centers, then other things may happen.
Ma'am, here, how can parents support their teenagers?
Yes, parents' duty is crucial. Very important thing. See, pinpoint control diet. As of first and only I told, it is a physiological event. Like how we are eating, urine formation, motion formation, everything's are there. From head to toe, there is a nourishment. Okay, that's why first be concerned about the diet. Meaning, item wise plus timings. What happened now? Now new generation, nightmares, night time not sleeping proper or late night sleeping and late time they are
Savings.
Internally in fun I used to tell the patient internal there is a clock inside the body or mixer inside the body, it disturbs because that what they are eating has to digest proper way and byproducts has to produce proper way. That's why diet very important thing. First is item wise, second is the timing wise. Not like 3 o'clock night or early morning they are eating and sleeping and waking up at 2 o'clock evening or afternoon. That is absolutely wrong. Then that is the quality of the food. Avoid junk food. Junk food is a good term. Junk is a junk. Only give the satisfaction. Having the colors, having the taste. Very nice, no? Chatpata, kurkura, and preservatives are there, colors are there. Please avoid. Please avoid. They are having n number of the chemical. This is not the right platform I'm supposed to tell. It is going to harm you. For a fun, once in a while is okay. Diet control is important. Second thing, make a habit to follow code of conduct of the day. In our science, it is referred as a dinacharya. When we are supposed to wake up, what the protocol, add yoga, I'm repeating, to your routine work. Now in the schools or in offices, they're forcing.
Yes,
Huh?
yes, sir.
But see, for as an individual, to avoid all these things, not only the polycystic, all so many metabolic diseases are there. One can avoid with the yogas and make a protocol in 24 hours, 24 minutes. If you are not doing, then it's a big question mark for the family also, no? For whom we are doing, for whom we are earning, and what is the output of it. That's why, no, medicines are D is last. Change your attitude, change your behavior, then diet, exercise in the terms of the diet, yogasan, and then if it doesn't happen, then of course consult a doctor. That's the C. Then the last one.
How is PCOS diagnosed and what are the tests involved?
Yeah, as a clinical diagnosis is first. Miss Doctor predicts she may have the golden diagnosis is a sonography, and for completion of it, we are advising blood investigation. But generally, based on the size or the volume of the ovary and endometrium, we are advising the different hormonal tests, like as now I told you, like this. Even some families, they have the history. We are asking the history to the mother, or we are asking the history to that lady. Own sisters, then mother sisters, or father sisters. They have the positive relationship. They have the menstrual irregularity. Please take care in a very early age only. Make a habit or try to avoid the polycystic.
So, ma'am, here does genetics play role
Yes,
in
that's why I told. Yeah,
PCOS?
yeah. Genetical role is there. Not only PCO, many gynecological diseases. They runs in family to family. More precisely, if you will ask me, no, so many years before, where there sonography and PCO and all, but that time lifestyle was different.
Yes.
Or
Actually,
sometime, yeah. See, positive side of the inventions or positive type sides of the researches, we know early. That time might be it happened, but it was neglected or patient doesn't conceive. That was the problem. Now we have the good investigative aids. That is the key for the diagnosis.
so
And
what are
sometime what happened, no? Sonographically, only the multiple follicles. That is the interpretation of sonography. Small follicle particles are there. Not exactly she is entering into the polycystic. But we can consider this alarming and we start treating that patient. Means counseling, diet, lifestyle modification. We are having the good panchakarma range also. Cleansing of the body. You might heard no panchakarma are 5 procedures. In that cleansing procedure also going to help for the polycystic. Yes.
so ma'am, what are the challenges faced by PCOS? A woman facing PCOS.
Yes. It's a challenge for her family, and challenge for doctors also. Because sometimes patient comes to us 7 months no period, 1 year no period. I faced the patient for 2 years no period. Patient was so happy there is no period. That she was early 23, 25 years. See, that's why the sleeping ovary we have to make her awake. That's the challenge. Some patients they require only withdrawal, some medicines, maybe Ayurvedic, maybe modern, because we are also having the range to get the menses, medicines to get the menses, medicines we are supposed to get. That's the big challenge. Then the grades of the polycystic. As I told you, all patients are not wholesale of same category. That's why clinically we are doing the grade 1, grade 2, grade 3, grade 4 like this. And something especially that hair developments, no, external hirsutism, that is a big challenge for the doctor, because once hair fall down, hairs are there, no, overnight it doesn't fall. Even with the medicines also they might require the cosmetic theory, and it is also not the promising. Multiple sittings are required because she is disfigured, no, and it is frustrating for that lady itself. Yes, these are the big challenge. Then it affects psychosomatic ways also. So many things. Why only for me? It's quite common. The girls ask me, why only for me? And first and they neglect. No, no, it will cure, it will cure. I'm not making afraid of you. Please take note of it. But it's a big thing. Because now if you see, no, the infertility is increasing like anything. Maybe the age, diet, so many things, stress factor. Polycystic contribute major effect. That's why to avoid that, please start working now. Our exam will be next year. Now, how we are studying That's the key. Yeah.
Ma'am, can you list some myths related to PCOS?
Yes. Myths related to the PCOS. Instead of that, myths related to the menstruation. See, because PCOS is a condition. No, there are so many conditions. Myths are there like that. If the menses does not come for few days, then it will come for so many days. This is a myth. Like there is no tank inside the uterus. One switch on, switch off. Second thing, like nearby the menopause, like 40 plus, frequent menses are coming, heavy menses are coming. One lady gives message to the second lady, that is absolutely normal. No, not at all. You require attention to the doctor because it is a key for the diagnosis. It is alarming sign for the diagnosis. Plus, you may get the anemia and so many things. Third thing, absolutely menses are not coming and not bothering because if that girl is having the painful menses and she think array menses are not coming, no, then she's a happy, but parent, especially mother, shall not be happy. Okay, that's why that is another thing. Another myth, as we discussed, when marriage is there, that time only our menses shall be regular. Absolutely not. It is your body concern. Love your body. How you are doing makeup and good dress, no, this is an internal sign. Okay.
What are the challenges faced by women with PCOS, like mentally and emotionally?
Yes, challenges. That means if she's cautious for her own, that is beauty. It's it's what defeminizing. It's so much stressful for her. It disturb for her. Then she become isolated. She don't want to mix in social activities. Plus fertility issue. Plus, see, no, imagine hair loss is there and absolutely chin hairs are there, pimples are there, obesity is there. Then second thing, irritability is there, mood change is there, depression is there, quite common. I'm not telling directly PCOD leads to depression. This is change gradually it gives the depression. Or some patient ask also, no, how many days medicines are supposed to take, like that. That is also depressive for them. Plus economical burden for them. Plus husband wife disputes or family expectations are there, no, completion of the family. Plus if it is untreated, she may have the diabetes, then blood pressure like hypertension or endometrial diseases inside the uterus, no, cancers and all. That's why these are the basic challenges. Some are hidden and some are related to the doctors, means forecasted. That's why don't restrict polycystic only for fertility. It is for our own health. Very, very important thing. Or some polycystic, they may come with to us with the breast secretion. How embarrassing it is. Unmarried girl and breast secretions are going on. Definitely the pathology is different, not only related to the ovaries. That is the syndromic way. Yes, some attack thyroid, some attack ovary, some attack liver or digest metabolism, some attacks breast, like this. Permutation and the combination. And the polycystic ovarian disease, that is the cystic formation into the ovary. New cyst. Cyst means layman terminology is a swelling, tumor, but the cyst is fluid filled sac, like the balloon. Newly it is not coming. That follicles, no, which is supposed to grow, it turns into the cyst. Like we know that the fibroid is there, polyp, so many growths are there. It is newly erupted from the own tissue. Here, the follicles which are yet to give the ovum, they turn into the cystic. That is the polycystic. Multiple. Poly means multiple. Cystic.
How is stress affecting PCOS?
Yeah. Stress, see, stress, it affect into the higher centers of the brain. म्हणजे pituitary, hypothalamus. There are different types of the stress, no? Like the physical stress. Here, I want to stress the mental stress. If you are asking the small child of 5 years till 50, 60, 70, there everyone is telling it's a stress. Small child, he may have the stress of exam. It's a very bad thing. He like that. That's why I laugh. Sometimes created stress and sometimes non-created stress. But definitely any stress is there. It is hampering to the higher centers of the brain, which control all the hormones. That's why one hormone is the stress hormone, steroidal type, where bulkiness of the body, fat, and everything disfiguring increases. That's a whole orchestra of the hormone changes or disturb with the stress.
So is it really very difficult to lose weight when a person is having PCOS?
I'm not telling it is difficult, but consistency is required because patients are coming to us ulta, means reduce my weight. I am telling them correct your menstrual cycle. When ovaries start functioning, your weight control and decrease will start. Not overnight. Keep in mind, it is not matter of overnight or 8 days, 15 days. Now, n number of the theories are there, but please try authentic. I'm not telling anything. Please try authentic. Diet control. We are having the Panchakarma range, the meditations, yoga. Correct your cycle. It is going to help you.
So, ma'am, how does PCOS affect women infertility?
Yes, the lady having the polycystic ovarian diseases, the chances for infertility are high in two ways. One, there is no ovulation, this egg formation is not there, which you can revert with the medicines. I am not telling polycystic means 100% she is infertile. No, with all these remedies, she can ovulate and she can have pregnancy. But there is definitely risk of infertility. Second thing, there is a configuration of the hormones is disturbed. That's why the chances for the abortions are also more. Chances are more. That's why it also affect the fertility. That means the sum total, the polycystic ovarian diseases or polycystic ovarian syndrome, they land into the infertility. Plus, addition to that, stress. Because once the vicious cycle, no, they're always thinking, "Arey, I conceive with medicines, whether I'm able to continue the pregnancy." That also affect, yeah.
Stress is there.
That's a vice versa.
So, are there any specific risks during pregnancy with the woman who has PCOS?
That is the purview of the doctor, more specifically. What doctors are telling or medical persons are telling that you have to follow. That is the first thing. My first experience was like this. My friend's experience was like this. It is on net or Google or what doctor is telling that we have to follow only 50%, or mother-in-law is telling so many things. We respect to all, but doctor is the right person based on her profile.
Right.
We are
Every
giving
body differs.
yeah, every body and every condition differs based on that the medicines and the diet pattern. Must.
So, ma'am, can you tell us what is importance of balanced diet or portion diet for women with PCOS?
Yes. Generally, diet plays important role into the maintenance of the health. What we are eating, no, we are showing on our body. That is the first thing. Not only the polycystic patient, all girls, means like growing age, adolescent age, proper diet shall be there in the quantity, in the qualities. Like common as the milk is there, available vegetables, vocal for local. What is available in our area, available fruits, exercise, that plays very important role. Precise to the polycystic ovaries, junk food she has to cut off, excessive caffeine, and then excessive carbohydrates in the terms of maida, please avoid 100%. All bakery items, which include sweets, that is the cakes, pastries, fermented, that is the toast and related items, which contain dalda also, means veg ghee, that's supposed to avoid. Then the fish from the deep sea, which contain additional salt. I am labeling them as a rich fish. The cromlets, crabs, prawns, having of course good source, but some bad items also. It is going to hamper your ovaries as well as the endometrial layer, that is the inner layer of the uterus. They add up for that. And the potatoes, sweet potatoes, everyday fried fish, everyday fried items, please avoid it. That is the first thing I'm advising. Then the curd is there. Buttermilk you can have. But morning, afternoon, some curd or curd related food. With cheese is there, additional paneer is there, tofu is there, or some vegetables. No, we are adding to that side milk cream on that. Please avoid. Don't mix it. That you have to avoid it.
So, ma'am, you have told like exercise play important role. So, in this busy schedule, how can women incorporate exercise in their daily routine?
Yes. See, busy, no, we have designed it. What I mean to say, we are eating, we are having bath, we are having beauty parlor items, we are working. In that schedule, no, give some time. Ideal time is a morning, wake early, and you when you're after passing of motion in a relaxed environment, sitting on floor, sitting on floor, you can add a chatai or mats, preferably airy environment. She has to do the yoga and meditation. Sometimes schedule like nursing and all those stuff, they have night duties, then they can do it evening also. The basic funda for that, before half an hour and after half an hour your stomach must be empty. So don't eat half an hour before your exercise, and after also followed by the shavasana. You might have no shavasana, just relaxing postures, that is important. Because now in that funda, no, array, you are doing yoga, I am doing yoga. It is not the rule. Do it properly. Just to make a ticking of it, I have done yoga, I ate, I bath. Don't do. When you are doing for yourself, no, then it gives the impact factor.
Ma'am, is there any specific asanas or pranayam that we can suggest women with
Yeah.
PCOS?
Ideally, she has to do the Surya Namaskar. Surya Namaskar is easiest, cheaper home exercise. Sometime, no, due to many conditions, they are not able to do the complete Surya Namaskar. Then Bhujangasana is there, Pavanamuktasana is there, Ardha Chakrasana, that it is supposed to do with consultation only. Vrukshasana is there, Parvatasana is there, that she has to do. Then meditation, under consultation, they are supposed to do. At least they are not able to do these asana, body exercise, the relaxing exercise she has to do. It is the simplest way. But I suggest consult doctor at least once, twice, and then you can do it. And how many days? Yes, questions coming like that. Make a habit. Previously, we used to tell that up to 3 cycles are regular. But I'm adding nowadays
Has to be continued.
exactly till time you want to be healthy. And there is no problem nowadays, because if I'm doing the yoga, if I'm doing the exercise, there are additional qualification. Right.
So, ma'am, this topic is not discussed openly. So, what do you suggest to parents or any women on this topic?
See, there are so many topics. It is not discussed openly, especially in the terms of the females. Common is the menstrual irregularity. Means periods are not coming in the times, or if it comes, it is not stopping. Second thing, second point itself is a white discharge. The girl or lady is having per vaginal white discharge. Some amount it is a very normal, like salivation in mouth, but it disturbs the routine, like burning is there, itching is there, foul smell is there, different colors are there. It is the time to discuss and take that girl or lady to the doctors, medical person. Then the third itself is or different diseases like polycystic diseases, polyps are there. Of them, definitely the polycystic awareness or polycystic ovarian disease awareness is a must nowadays in the society. You are victim of that, means you are having polycystic or not. Definitely awareness is required. Every girl, every parents, mausi, dadi, nani, they are supposed to aware for is this, so that we can conquer it through the motivational talks, through the discussion, through the treatment, and so many things. That's why I feel very very important issue. As a Ayurvedic gynecologist, we are also being working on that, like awareness talks we are giving in the schools, colleges, higher secondaries, or in ladies groups, Mahila Mandal and all. Along with that, we are doing the different camps for specifically camps. Alright, I am working at Gomantak Ayurved Mahavidyalaya, Shiroda, Goa, as a head and professor of the Sri Rog Prasudi Tantra, that is a Ayurvedic gynecology. We are conducting regularly OPDs. There also we are looking the patient. Plus, one devoted day is there, Thursday. Polycystic OPD is there. With previous reports or without previous reports, I'm appealing to the society. They are supposed to visit and get consulted. Plus, I'm having my own private clinic at Honda. The patients are welcome. Necessary not to take the medicines, but definitely to consultation. Yes, that is the first step. And earliest time, not necessary after marriage 2 years, after marriage 7 years, after marriage 5 years. Patients are coming. Please, okay.
Thank you so much, Dr. Geeta ma'am, that you have given us lots of knowledge and we can say consultation on PCOS, PCOD. So thank you very much.
Thank you very much. Thank you very much for Unique Achiever channel and Madam Sneha, no? Yeah, and Mr. Kaushal for giving me this opportunity. Definitely on this platform, I'd like to work. I'm always there. Thanks a lot.